Welcome to Health Matters, a show about what matters to your health here in Worcester and Central Massachusetts. Our show is a collaborative effort of the Worcester District Medical Society and WCCA TV, the People's Channel here in Worcester. I was going to say Channel 194, but it's also found on Roku and a number of other platforms. My name is Jay Broadhurst. I'm a family doctor here in Worcester, and I'm delighted to be your host this evening. I'm joined by my good friend and colleague, Dr. Christina Runyan, but I call her Tina, so I'm going to do that.
Yes.
And she calls me Jay, which is great. Dr. Runyan is a clinical psychologist, PhD. She's a professor in my Department of Family Medicine and Community Health at the University of Massachusetts Medical School and Medical Center. I've worked with Dr. Runyan for years and years in resident teaching, in student activities, and in clinical care. And that clinical care, interestingly enough, has been at the Boston Marathon, where I've been privileged to work as a physician. But Dr. Runyan is one of the clinical psychologists who supports runners in the tent who may be having struggles, having just run the most important race of their life or had a difficult time. We're not here to talk about that specifically tonight, but it's part of who this woman is. She also served our country in the United States Air Force prior to coming to Worcester. So lots in Dr. Runyan's background. So welcome, Tina. I'm glad you're here.
Thank you, Jay. It's a privilege to be here.
One of the specialties that you have is helping people, frankly, like me and other caregivers, understand how important it is for us to pay attention to our health as well as in order to be able to care for others.
Yes.
And I'm thinking now about this COVID-19 pandemic, which has been going for 9 months. We have a vaccine on the horizon, which is really exciting, but there seemed to be a tremendous amount of fatigue that is now being experienced by individuals in the community who are just tired of not being able to go out to dinner, to go over to a friend's house. And when they do go over to a friend's house, then all of a sudden the public health officials and the leaders start yelling at them and saying, wait a minute, you're spreading the virus. And sadly, the data says that that's one of the ways the virus gets spread. But at the same time, we see, and now increasingly in the last few weeks, see caregivers being interviewed about how difficult it is to see another person coming through the door, 2 more, 5 more. Where are we going to put these people? How are we going to help them? The good news is 9 months later, we have much better ways of treating people with this disease. Not quite so many people are dying, but many, many, many people are getting infected by this. So it's continuing, and it's a stress and strain for all. So what about caregivers? What is the message that you begin with when you're seeing somebody like me who says, I'm just tired?
So I didn't know you were going to bring up the work with the marathon, but I think it's really apropos, actually, to this question, which is, in many ways, at the start of this, sort of not knowing, I think people really had a response, very gung-ho. I've been training my whole life to do this, sort of put me in, coach, right? I want to do this. And thought it was something like a 5K. That it was going to just be... That's right.
Go out and you run for,
and go full,
half an hour,
right? You sprint,
and we're done.
And you go as fast as you can and get to the end of that 5K and say, oh no, we've moved the finish line. And so I think a lot because of that, the fatigue is showing up because we are now sort of even post-marathon, if you will, you know
Yeah.
that space in the marathon where you cross the finish line and then it's like another, 200 yards to get your medal in the water. It's like that keeps getting pushed back as well. And so we're into one of those ridiculous, like, ultra marathon things that
Right.
some people run. So, and I think caregivers, and I use the term caregivers, well, my particular clinical work is with clinicians, specifically health professionals.
So physicians and nurses?
Correct. Anybody sort of in direct patient care, as well as leaders in
Right.
healthcare. Yeah.
I see. Okay.
So, but I use the term caregiver broadly in terms of anybody who's caring for somebody and what this fatigue looks like and why it's so difficult. And I think that the most of us are really activated in our nervous system. This is how I've come to understand what's happening now in terms of the mental health sequelae for clinicians and that exhaustion. You know, they're working so hard and yet they continue to see people. It's a revolving door coming in. That everybody's nervous system is very activated because there is a very real threat out there. It's an invisible threat.
Yep.
We have some information about how it's transmitted, but not really good controls because we can't actually control another person.
Right. Right.
So I think we all have very activated nervous system, and when your nervous system is activated for a 5K or for a short term, you can manage because our systems are actually exquisitely designed to do that, to confront a stressor, to have to adapt to that stressor and actually grow stronger from it. But we haven't had any rest. In order to do that, you have to have some rest and recovery.
If I'm starting a 5K, I know where the finish line is. If I'm starting medical school,
Right.
I know it's almost always 4 years.
Yes.
And that may be hard, but I know that there will be an end. And I wonder about this because it seems to me that if my nervous system is activated and I'm, ready because I might have to run a code or I might have to take care of somebody who's, acutely ill or whatever, there's a time that I can go home and I can relax and I can get a good night's sleep and be refreshed and ready to go tomorrow.
Yes.
So why isn't that true now?
And that's not the conditions now, because you go home, and many clinicians and caregivers in many places are going home perhaps even more activated, because not only are they caring for people in their work setting, they're holding a lot of that fear and uncertainty in terms of going home. And they certainly don't want to be the person who is exposing other people in their household. And so they're afraid. And when our systems are afraid and there's fear, we're very activated, physiologically activated. There's a lot of cortisol, a lot of adrenaline, a lot of allostatic load on our system that... I'm sorry, allostatic load? That's the stress on our system, because our fight-flight system, our fight-flight or freeze system, is wired in us, beautifully so, to prepare us for a threat.
Right.
Something that is going to threaten our livelihood, our identity, our safety, which COVID is.
Right.
We just can't see it. We know it's out there. We know, but we don't know exactly where or who is at risk. So our system says, I better stay on high alert all the time.
But we can't.
I think that's what we're seeing. I think the fatigue is that our bodies are actually not programmed to do that. And the things that heal us, the things that help us, have actually largely been taken away. Those are things like being in community, social connection, touch in medicine, right? Touch is an incredibly powerful healing tool above anything, really technical or advanced or diagnostic.
Yeah.
Really just that presence and touch, because our systems know that too.
I remember a wise physician told me once early in my career how important it was that you touch what hurts. If somebody comes in and says, my knee hurts, then you need to examine their knee. If there's a blood pressure problem, you need to get out your stethoscope and put it on their chest and listen to their heart.
Yeah.
And it's the watchword, it seems to me, with this virus has been, we have to stay apart. It's 6 feet, social distance.
Yes.
Wow.
And it creates, I think it creates, it changes in that encounter. It really changes for clinicians what brings them meaning and joy and purpose. And so I think early on, not having the answers, working so hard in a way that felt futile was exhausting and really, really threatening to people's well-being, particularly in the caregiver sense.
So it sounds as if it's very important for caregivers to have a understanding and have a way of caring for themselves, of sort of building resilience. So in your experience, do caregivers get taught how to do this? As people are progressing in the world of being a caregiver, do they get taught how to do this, generally speaking?
So compassion, I think, is innate. Compassion doesn't actually need to be taught so much. We are all innately wired for recognizing compassion.
But isn't that mostly compassion toward the person you're caring for?
Yes.
As opposed to, I mean, when I was to medical school, I was taught to be kind of self-critical.
Yeah.
Like, I need to learn more. I need to get better. I need to practice those ability to tie sutures or whatever, because, when it came time to care for the patient, I had to be perfect.
Yes. Yeah. So I do think physicians in particular, nurses, healthcare professionals are incredibly resilient human beings because they've had to be. They've had to figure out how to face and overcome adversity in terms of the cognitive, emotional, and physical lift of training.
Right.
However, I do not think they are taught, certainly in terms of what we consider sort of self-care or compassion towards self. Incredibly good outpouring of compassion. Almost taught the opposite, really, just as you're describing, in terms of being able to be compassionate towards oneself, of recognizing one's own limitations, or just recognizing the need to take a break. And our systems, unfortunately, are not really set up to do that and support people in that in a way that makes it easy for them to do the right thing, to makes it easy for them to take a break, to nourish themselves, to hydrate, to go to the bathroom on a 12-hour shift. So that, I feel like, those are skills. And by skills, I very intentionally mean things that can be taught and strengthened, but are often not part of the traditional nursing or medical school curriculum, because it is there's actually a message of self-sacrifice, as you describe, and of tending towards others, as opposed to recognizing that flow sort of has to be a continuous loop, and it has to be both outward and coming inward. It's sort of like our breath in that way, right? Yeah, like we don't just exhale. We would not survive if we only exhaled.
Yeah.
We have to be able to inhale so that we can exhale.
Well, there are many simple exercises that I've come to learn from, frankly, you and people like you, which have taught me that something as simple as being mindful about one's breathing can help be restful and restorative, if only for 30 seconds or a minute, before you go into the next patient's room, or you talk to the next caregiver about a team difficulty in caring for a patient. Let me just pause for a moment and say to our audience that you're watching Health Matters. My name is Jay Broadhurst. I'm here with Dr. Christina Runyan. We're talking about skills to sustain caregiving in an environment where they're sorely needed. And coming back, Dr. Runyan, there's a term called burnout, which is being used a lot in the caregiver world,
Right.
where the most obvious manifestation is somebody who has been working, been providing care, and then, quote unquote, burns out. And the obvious manifestation is that they just say, I can't do it anymore.
Yeah.
And they stop. They leave. They leave nursing, they leave respiratory therapy, they leave physician work, and they just say, I can't do it anymore,
Yeah.
which is a terrible loss for the people they were caring for. But it seems to me it's a loss for that individual as well. And what thoughts do you have about what you see in burnout
Yeah.
and how that's being handled these days? And more broadly, what do we need?
It's a lot in that
sure.
question.
In the next 3 minutes, you could just...
Particularly in healthcare, a quote came to my mind, which I probably won't recite exactly, but it's Rachel Naomi Remen, who is, I think she's a family physician and a palliative care doc, I think.
Right.
And she says something around like to pretend that we could, sort of swim in these waters and not get wet, right, is just sort of not recognizing that the suffering that we are all encountering every day, particularly in the healthcare realm, to imagine that it's not going to affect us and our humanity is really a failure of a system, and a system, kind of big system, but also a system, like we're a system, to recognize that of course it's going to affect us, and it should. And actually the burnout is often people will describe, it no longer affects me, and that's not okay. I no longer feel, I can't empathize, I can't muster that compassion. And that's so antithetical to this oath that I took and my identity that I have to step away. That's what, sort of an emotional exhaustion component of burnout, if you will. Traditionally, burnout has 3 components. That one of emotional exhaustion, the second being cynicism, just sort of, some negativity toward patients, treating people as kind of objects, not feeling that human connection. And the third is the sense of personal accomplishment. And actually that's probably my biggest concern in the time of COVID and COVID fatigue, is that usually personal accomplishment is not one of the first manifestations of burnout. You usually see some emotional exhaustion prior to that, or some cynicism prior to that. But that's one of my concerns in this time of COVID, is that people feel like they are showing up and not making a difference. And whether it's not making a difference in somebody's overall kind of health or life, like saving that life, or addressing the anxiety. I think in a lot of ambulatory primary care settings, really addressing the anxiety and worry that people feel.
Right.
A shared colleague sent an email a couple weeks ago after a Friday and said, every patient I saw today had such extreme COVID anxiety, I don't know how to do this.
Right.
What do I do? And I think hidden under that message was, what do I do?
Right. With myself. How can I provide reassurance in some meaningful way to the patients? But where is that reassurance for me, for my family, for the people that I love and care for? Yes. Who I hold more closely.
Yeah. And that's really been I think for caregivers has been, in therapy, we'll call it a parallel process of sort of what happens in the therapeutic encounter oftentimes mirrors what happens in people's lives and other relationships. And I think, it is rare, for example, for an oncologist to be dealing with and managing their own cancer at the time that they are caring for people, day in and day out with cancer. Right. It happens, but it's rare.
Right.
We have a situation now where all of us, is this shared humanity, are dealing with the threat and the worries and the reality of COVID and how that shows up in our personal lives, tending to kids, being a part-time teacher, worrying about older, parents that are older or grandparents, and having to do this work. And so it immediately leveled the playing field.
Yes, it does.
And for some people, that's actually really helpful. And for some who maybe really prefer to be in a stance of fixing,
right,
it actually is really disarming.
Right.
To all of a sudden have such a shared experience with patients. And that requires some real attention that I think hasn't, we didn't have time,
right,
honestly. And it's not, it's something that I'm pretty passionate about. It's not really baked in curricularly to the training pathway for a lot of health professionals.
So how is it that there are some caregivers that seem to do better and some that have more trouble with the area of, can you be inoculated against burnout?
Yeah.
In the same way we're trying to inoculate people against infectious disease and soon, hopefully, with coronavirus.
So I think there is actually some reasonable evidence that we can do some of that. Some of this you'll see in the military, and they're doing basically fairly widespread, sort of stress inoculation training, and trying to raise the level of water for everybody, knowing that people are going to be going into really high stress circumstances. This is actually what got me very interested in pivoting my practice to caring for clinicians.
Okay.
Is because I was certainly experiencing a lot of this myself, and you'd think as a psychologist I would sort of be imbued with all of these, skills.
Right.
But it wasn't so evident to me of how can I apply those to myself in order to sort of sustain this work. And that's really where I got interested in thinking about curricular development and thinking about skill acquisition around some of these things. So I absolutely think it can be taught. We can do some to inoculate. I think there are some systems changes that are necessary to help people be able to use those and to celebrate when people are doing that. We have a lot of ways of celebrating sacrifice in medicine, in particular, and not so many good public recognitions of compassionate boundary setting, for example.
Isn't that something? So this is something that can go beyond the individual caregiver to the system in which they work.
Absolutely.
And that could be obviously a hospital system or an academic medical center, but it could be a home health agency.
A nursing home.
For instance, a nursing home.
Absolutely.
Or it could be, maybe even a daycare center, where you've got teachers who are caring for kids every day.
Yes.
Or the teachers now who are so used to having children in their classroom that they can hug.
Yes.
Or, provide a safe environment, but now they're on some electronic platform trying to reach these kids. Must be very hard for that group as well.
A very simple skill, and I will work with people on this, is when we can tap into our meaning and purpose for doing whatever work that we do as a caregiver, whether we're in a long-term care facility or as a teacher or as a nurse or a physician, because that can feel very distant and remote on the day-to-day.
Yep.
But when we can tap into that, and not all of us are driving home these days, but to have some kind of ritual of sort of, whether it's between encounters or at the end of the day, where you reflect, what did I do well today? Or what did I learn? Or what difference did I make for somebody? Where we actually incline our minds towards something around our meaning and purpose. Because our minds have such a negativity bias, they will automatically go, if you walk out of your home office or drive home, how was your day? Well, I'll tell you what. You won't believe what happened, right? Our minds will automatically go to the stressor. It's just how we're wired. So we have to be very intentional about inclining our mind toward the positive. And we can do that, write it down if you want. You can say it out loud. You can even just do it internally.
But it sounds like that is something that sounds pretty simple, but just you need to make that intention to do it. And just to say at the end of the day, what went well?
Yeah.
What was fun? What made me smile?
Yes.
How did I make a difference?
Yes.
There are a number of ways but you had you're the professor here. So tell our audience again, what are some of the ways of framing these affirmative, self-affirming kinds of thoughts and feelings at the end of the day?
Yeah. So I think it's important to find language that works for you as an individual.
Right.
And I like the phrase, actually very intentional. I like your phrase of what went well, but also when you say, like, what did I do well?
Okay.
How did I make a difference? You are bringing some of that sort of recognition onto yourself. And most of us can know that, even if it's not expressed, in traditional ways of like rewards or recognition, right? We can know it from a particular patient encounter, or a teacher and a student, where you have that aha, to say, like, that matters.
Yeah.
And regardless of the conditions and it being on Zoom, or like, that matters. That's why I'm here. So anything like that to incline your mind, and we do have to be intentional. So finding the language that works for you, but I do like having it to think about yourself as an instrument in that. So,
well, we're coming to the close, sadly, of this show, and I wonder, just final thought about, I don't know, food to sustain yourself. What did I do well today?
Yeah,
that's one of the things. Any other thoughts you have about your work with caregivers? And
so I think as a whole, when I think about COVID fatigue, and I think about how it's really playing out on the level of our physiology, I actually think about soothing things that soothe our nervous system. And those are things like, smelling something good, music, sound,
wrapped up in a nice blanket, fuzzy blanket.
Like literally caring for one's nervous system.
Care for yourselves, please. My name is Jay Broadhurst. I just want to thank you for joining us with Health Matters on this show. I've been joined by Dr. Christina Runyan, an expert at the University of Massachusetts Medical School, clinical psychologist. I do want to thank our engineer, Frank Rocco, for all his work in helping make this show come to life. And I want to thank you, our audience, for joining us on Health Matters. I'll see you next time.